Hey, the patient is here. Mr. Smith is a 55-year-old male patient, has rushed himself to the emergency room, complaining of chest pain. He reports the pain to be extreme 10 out of 10, which radiates to the left shoulder and jaw. As you took the vital signs, you note an elevated blood pressure of 140/90 with a pulse of 112 beats per minute, which means tachycardia. The attending physician immediately orders for a 12-lead ECG and behold, the result shows ST segment elevation. He suspects myocardial infarction. According to the World Health Organization, every year 20 million people will die because of myocardial infarction, which is also known as heart attack. It is the leading cause of death in the whole world. Today, nurses, we are going to talk about heart attack and hopefully, in the future, save someone from dying. Myocardial infarction can happen to anyone. It is the complete blockage of a coronary artery, which supplies the heart muscles with blood. Heart muscles are also called myocardium. Now, without the blood flowing in the heart, there will be no oxygen supply in the myocardium. And what do we know about when cells does not have enough oxygen? Yes, they die. Now, we don't want that to happen, especially in the muscle cells of the heart, because the pumping of the heart will stop. And when the pumping of the heart will stop, humans tend to die.
Oh my god, bro.
Oh, hell no.
Now, I know that studying the complex pathophysiology of this disease will make any nursing student's minds go boom. So, I will try to make it easy for you. Now, let's talk about risk factors. If you smoke, drink alcohol, live in your mom's basement, and have someone in your family who had a history of cardiovascular disease, then congratulations, you just earned your ticket for being at risk of having a heart attack. These factors will lead to the rise of cholesterol levels, such as your LDL, aka your bad cholesterol, and triglycerides. Eventually, throughout your body, plaques will form and they like to stick to the walls of your arteries, which damages them and makes the overall vessel narrower. Then, all of a sudden, these plaques will fly off into deeper vessel, which is called a thrombi, which will end in the complete blockage of the artery. So, no more blood is passing through. No more blood means ischemia, then necrosis. Your heart muscles die, which will lead to arrhythmias and eventually death. And that, my dear nurses, is how 20 million people die each year. But not Mr. Smith though. With the help of the healthcare team, we will try to save his life. So let's get back to the situation. The doctor orders a stat 12 lead ECG for Mr. Smith, and the results, well, it shows the ST segment elevation. What does this mean? To put it simply, ECG or electrocardiogram is measuring the electrical signals from the heart which follows a specific patterns of nodes firing. I will do a deep dive of ECG in the future, so please subscribe. Basically, an ST segment elevation is Mr. Smith's heart ventricles shouting that it does not anymore receive oxygen and is slowly dying. But unfortunately, an ST segment elevation will not confirm a heart attack because of other conditions such as pericarditis, which will also show an ST segment elevation. To confirm a myocardial infarction, Mr. Smith's doctor will need to look into the blood in search of a specific protein that is the result of cardiac cells dying. And ladies and gentlemen, let me introduce to you troponin, which is a key indicator of a heart attack, along with other markers such as CKMB, which is creatinine kinase, and myoglobin. It will rise and fall at specific time, so we need to look after it. Now, the doctors have finally diagnosed that Mr. Smith truly has a myocardial infarction, And hold and behold, time is running out. The doctors can treat the symptoms such as pain, but it will not reverse the damage of a dead heart. So, what do? Percutaneous coronary intervention, or also known as a PCI, is the gold standard in solving your daily heart attack problems. It is basically a minimally invasive procedure which starts in a huge artery in the groin where a small catheter is inserted and guided to the coronary artery, where contrast medium is used to locate the blocked artery. Then, a balloon is inflated to flatten out the plaques. Lastly, most PCIs involve putting a stent to prevent artery from narrowing again. And voila, your blocked artery are now unblocked. Now, let's talk about symptoms management and the role nurses play. Apart from chest pain, most MI reports the feeling of impending doom, which makes them extremely anxious. I mean, let's say it's basically the feeling of dying, right? As nurses, it is our role to help manage these symptoms. Also, it is not uncommon to see oxygen saturation lower than 94% in our patients. It is our role to immediately give oxygen until 2 liters per minute or until the physician orders a higher dose. So, for MI patients with an SpO2 lower than 94%, our first order of intervention is oxygen. Because remember, myocardial infarction or MI is the lack of oxygen in the heart muscles. We cannot give something that we don't have. Now, I know you heard about MONA, which is morphine for pain, oxygen, well, if the SpO2 is lower than 94%, nitrates to dilate the vessels, and aspirin as an antiplatelet. But which of the following should we use first? Well, it is highly debated which of the following will be used. But this definitely depends on the situation and how the doctors will decide. If there is the use of morphine, which is a potent opioid analgesic, we must watch out for opioid poisoning, which is usually presents with a decreased level of consciousness as well as decreased respiration. Have your Narcan, the antidote, ready in the bedside, as well as intubation set. Doctors will also use fibrinolysis, depending on the onset of the condition, and as well as benzodiazepine to calm the anxiety. And lastly, let's talk about CABG, coronary artery bypass graft, an alternative for PCI, which involves harvesting vessels from other parts of the body and using it bypass the clogged artery, the heart. This procedure, I may say, are pretty darn expensive. But hey, they say we cannot put prices on human lives, right? Now, after a few days with percutaneous coronary angioplasty done to Mr. Smith, with the vessels fully unlocked, we can finally say that Mr. Smith is gonna be okay, right? Wrong. Having a heart attack requires a lifetime of modification, especially to Mr. Smith's lifestyle. So don't forget to do discharge teaching of the following to Mr. Smith. Firstly, reduce high cholesterol diet, which means less on the fats. Doctors will usually prescribe a statin to help lower cholesterol. Aspirins are also commonly prescribed post myocardial infarction to reduce platelet aggregation. Most importantly, your patient must increase exercise gradually after a heart attack, but be very careful because we need to monitor the heart rate of the patient. And you should probably touch some grass and get out of your mom's basement if you don't want to suffer the same fate as Mr. Smith, right? Right?
Bruh.
And we should also tell Mr. Smith to not consume more alcohol or, you know, reduce or kill the alcohol consumption completely. And stop smoking, of course, are also really important to teach. And lastly, we must teach our patient on how to manage their hypertension and diabetes. because it is significant risk factors for another future MI. And don't forget to lose weight if you're overweight. Finally, Mr. Smith can now go home and tell everybody that he has cheated death and lived a second life. Fortunately for him, he will not be part of the 20 million people who will die from a heart attack. Well, at least for now. So let's talk about a few nursing responsibilities that it is important for us to be reminded about. Number one is monitoring of vital signs. It is really important for us to monitor the patient's vital signs, especially the heart rate and the blood pressure of the patient during his or her stay in the hospital. And we shall also familiarize ourselves with the various MI medications as mentioned before. We shall also need to be familiar with the various electrocardiogram results that we get as ordered by the doctor. Although we are not the one who's going to interpret those ECG strips, but it helps us be more proactive in terms of seeing what's wrong with the patient and reporting it direct to the doctor. This includes also the labs. We need to be proactive in monitoring the laboratory of the patient. Especially the the troponin I. We shall also watch out for a common complication of MI, the congestive heart failure. When the heart is not beating properly, it is common for the blood that is coming inside the heart to not be pushed properly outside the heart, which means it's going to be congested throughout the system. That's why we look to the X-ray of the patient. We also monitor the lung sounds for the crackles. We also see if there's edema in the body, especially in the peripherals. And this is the time when the patient really needs us as nurses. So we must offer the comfort that we can give to the patient. Now let's talk about complete bed rest without bathroom privileges, which means our patient during the time that they stay in the hospital, they are not allowed to even get up on their bed or go to relieve themselves in the bathroom, which means they are going to use a commode. Why do we do this to them? It's because we are trying to avoid further strain to the heart, which will require more oxygen use, which the body or the heart does not have because it's already clogged. So that's why we let them have a complete bed rest. So that concludes our myocardial infarction made easy. I hope you get something out of this video, and if you do, please like and subscribe and hit the notification bell. And what is the lesson for today? Please be active. Live a healthy lifestyle. Go out, touch some grass. And with that, thank you very much for watching Nars Academy, and I will hope to see you in the next one.